Hello, my people. Today is pharmaceutics. We are going to talk about good pharmacy practice, GPP, relating to respond to prescription. We are going to talk about GPP. From there, next we talk about responding to prescription. But let us learn or know what is good pharmacy practice, GPP. GPP involves providing safe, effective, and patient-centered pharmaceutical care, encompassing the quality of medication, accurate information, and monitoring of medication use for prioritizing patients' welfare. Now, let's look about the concepts of GPP, good pharmacy practice. 1. Patient welfare. Pharmacists primarily concern is the well-being of the patients. 2. Optimal medication. GPP aims to ensure that patients use their medication appropriately and safety. That's the safety of the patient. 3. Patients' education. Pharmacy provide patients information and advice to help them understand their medication and their role in managing their health. 4. Collaboration. GPP encourages collaboration between pharmacists and other healthcare professionals to improve patient care. 4. Quality assurance. GPP ensure the quality, GPP emphasize on the importance of ensuring the quality of medication and other healthcare products. 6. Medication dispensing. GPP emphasizes that the correct medication in a correct dose and form is dispensed to the right patient. 7. Patient counseling. Providing patients clear and consent information about their medication, including how to take their medication, how to take them, potential side effects, and interaction with other drugs. 8. Medication monitoring. Tracking patients' response to their medication therapy and making adjustments as needed. 9. Communication. Pharmacists' effective communication with patients and other healthcare professionals. 10. Professional competence. Pharmacy should have the necessary knowledge and skills to provide effective care. 11. Reduce medication error. GPP practice can help reduce risks of medication error, leading to safer patient care. Patient satisfaction. Patients who receive good health care from pharmacists are more likely to satisfy with their pharmacy service. Pharmacy continuous education. Pharmacists are expected to maintain and enhance their knowledge and skills in professional development. Public health initiative. They may participate in public health initiatives such as vaccination programs and disease prevention campaigns. Drug safety and quality. Pharmacists ensure the safety and quality of medication distributed to the public. Regulatory compliance. GPP require pharmacists to be aware and comply with all relevant laws and regulations governing the dispensing and use of medication. Let's talk about prescription. GPP is a broad topic. We will talk about it later. I just mentioned some few concepts. So when we are talking about prescription, you will understand what I'm saying. The GPP is the broad topic. So now let's talk about prescription. What is prescription? Prescription is a written, electronic, and verbal order from a licensed healthcare provider such as physician, dentist, or nurse practitioner directing a pharmacy to prepare and dispense a specific medication to a patient. A prescription is abbreviated as XR of prescription. And the part of prescription, one, we have the prescriber's information. That is the one that if it is a doctor, a dentist, or the one that prescribes, that writes the prescription. So it's the prescriber's information. For example, let me use for example. I will say, for example, when you are writing the prescriber's information, under the prescriber's information, you see there the name of the prescriber, qualification and designation. And the qualification and designation, for example, the qualification is a doctor of pharmacy. So the qualification is the qualification. So the designation should be PharmD. So if I'm writing my name, I will say Dr. Finda Blessing Gombu in brackets PharmD. That's the name of the prescriber. When it comes down name and qualification and designation, when it comes to the address, when you are writing the address, you're not going to write your home address. Your place of work address you're going to write. And also, you will not be working at Connaught Hospital. You can write 34 Hospital as your address, or Life Care Hospital as your address. For example, we say Connaught Hospital, and the ward you are working or the department you write is the address. And after the address, you write your part of the where you will prescribe the prescriber's information. You need to write your signature. But at the top right hand side where you are writing your information, you're not going to sign there. There is a space down there for you where you are going to sign. So you will not sign up on the top right hand side. So when after your cell phone number, you write your license number. So after writing your license number, done. Come to the next one, which is the patient's information. And the patient's information include name of the patient, age, stroke, date of birth of the patient, date of birth. Although you are going to take the contact of the patient, but you're not going to write it on that prescription paper. You will write it on the form the patient will leave. There is a separate form where you take the information of the patient, where the patient told you that this is what I'm feeling. I'm feeling my head, I'm feeling my back, where you write all those things. The form the patient will leave in the hospital. Instead, you're going to write the patient's telephone number for any refills. So you're going to call the patient back for the next medication. So you write the patient's information. After the patient's information, you write the date of prescription. For example, you say the 12th April 2025. For example, today. So the 12th April 2025. And after the date of prescription, you will have a superscription. And the superscription represents XR. XR, the superscription. And after the superscription, you move now to the inscription. The inscription includes name of the drug, in brackets the genetic or the brand name of the drug, to strength of the drug. Like for example, when I'm writing my inscription, like for patient that is having high blood pressure, I will say thou amlodipine, pardon me, and the strength of the drug, I will say 5 milligram. 5 milligram. So after the inscription now, I move now to the subscription, the pharmacy, and how to prepare the drug or dispense the drug. So I will say mix and dispense 30 tablets. We move to the signature. The signature is not the one that you go and sign off. The signature now means the route of administration, dosage, frequency, and duration. Like for the route of administration, since I have told the pharmacy to dispense 30 tablets, obviously the route of administration for tablets is PO. That means by mouth. The dose is obvious tablets. The dosage form is tablets. And the frequency now, as we said, 1 tab QD. And the QD mean every day. So since I've said 1 tab QD, obviously the pharmacy will understand that, because when I say every day, I've told him that, so I told him or her that the pharmacy that dispense 30 tablets. Obviously the pharmacy should understand now it's for 30 days. So we have done now with the signature, and we go now to the refuse, if the medication after 1 month, the patient will come again for another medication. So I write my refuse 2. One now, which is warning and special instruction. Like for example, I will warn the patient if I know that due to the patient's appearance, I know that this patient is addicted to alcohol or is addicted to drug. So I will advise the patient avoid alcohol or avoid drug addiction, just something like that. I will tell the patient if the medication you should not mix with the medication, don't need to interact with another drug. I will advise the patient. Let's talk how they abbreviate medicines. How they abbreviate them, the abbreviation names of medicine. OD, right eye. OS, left eye. PO, by mouth. QD, every day. BID, twice a day. CID, 3 times a day. QID, 4 times a day. HS, at bedtime. IV, intravenous. IV, intravenous. IM, intramuscular. SL is sublingual, which is under the tongue. SC, subcutaneous, under the skin. Subcutaneous, under the skin. Get in. SC, that which is immediately. Then we have AC, before meal. PC, after meal. SOS, if necessary. QH, every hour. Q2H, every 2 hours. Q4H, every 4 hours. Q6H, every 6 hours. Q8H, every 8 hours. Q12H, every 12 hours. And we have the prehab, which is the perirectum, which is the medication they give to the anus. We have the PV, which is the pre-vaginal, brackets vaginally, the injection they give to the medication they give to the vagina. We have CX, which is for treatment, diagnosis. I have DX, which is a diagnosis. We have DC, which is discontinue. We also have some units. We have the ml, which is the millimeter, and we also have NEB, which is nebulization. That is medication they administer to nebulizer. The fluid is compacted into a fluid, put it into the nebulizer to inhaling. SUPP, which is suppository. Suppository is the medication that they are labeled to administer to the anus or the vagina. And we have NPO, which is nothing, by mouth. And we have the UNG, which is ointment. We have TAP, which is tablets. CAP, which is capsule. So how to know that this prescription has a mistake? So let's say question 1. A prescription reads: patient's name, Abi Kamara. Drug name: amoxicillin. Strength of the drug: 5 mg. Quantity: 30 capsule. Direction: take one capsule every 8 hours for 7 days. Refill nothing. So what's important part of the prescription is missing? Only yes, there is two, but the main important thing that is missing, that is the main important thing that is missing in this prescription. And when a patient, you as a pharmacy, you receive this prescription, how to interpret it to let the patient know that the instruction, how the patient will take the treatment. So we are going to calculate. We are going to do calculation also. But the first thing important, the prescriber's information is missing. Well, you as a pharmacy, you receive this kind of prescription. How to interpret another direct the patient. They said 5 mg, the strength of the drug. The quantity of the drug is 30 capsule. Direction: take 1 capsule after every 8 hours. Every 8 hours for 7 days. So you as a pharmacist, how to instruct the patient to take this medication. First, what you need to know, he said every 8 hours. The first thing you need to know, we said 24 divided by 8, which is 3. So you have known now, this is 3 times. You are going to mark now 1 morning, 1 evening, 1 night. So you're going to write 3 strokes, so the patients will know that this is 1 morning, 1 evening, 1 night. But the most important information that is missing is the prescriber's information. Let's go again to the second one. Sam, the prescriber's information is missing. Let's go to the second one again. A doctor prescribe ibuprofen. A doctor prescribe ibuprofen 4 mg, 1 tab, TID, PRN, pain. Where they ask us now, the patient asks, how often should I take this? So you as a pharmacy, how you are going to instruct the patient to take this tablet? They say 1 tab, TID, PRN, pain. So the first thing you are going to know that since 1 tab, that obviously is tablets, is the dosage form, and the route of administration, obviously since it is tablets, is by mouth, obviously. And how to take the drug, this TID means 1 tablet thrice as needed or when needed, because PRN mean as needed or when needed. So it's the way how to instruct the patient now to take 1 tablet thrice, 3 times a day when necessary, when needed or as needed. 1 tablet 3 times a day when needed or as needed. So let's go to the second one. Exactly. So we have another one. A pharmacy received a prescription writing as follows: Exhale paracetamol 5 mg. Signature: 1 tab, Q6H, PRN fever. Dispense 30 tablets. The patient took 2 tablets every 4 hours instead. So what is wrong here? This first, they said 1 tab Q6H. So let's know that that is 6 times. That is a 6 hours after every 6 hours. So since after every 6 hours, we say 24 divided by 6 is equals to 4. That means the patient needs to take 4 tablets within 24 hours. That's after every 6 hours, 1 tablet. The patient is supposed to take 4 tablets for 24 hours. 4 tablets for 24 hours. And now the patient have taken 6 tablets for 24 hours. That means is overdose. Let's go to the second one. It says a prescription says tab metformin 5 mg. Signature 1 tab POBIDAC. How do you interpret this? Fine. So let's go. So 1 tab PO mean by mouth. By mouth. PO by mouth. BID, that means twice a day. That 2 times per day. Twice a day. 2 times a day. And AC mean before meal. That means you need to take 1 tablet by mouth 2 times before meal. Means 1 tab POBIDCA. Let's see the answer. See, take 1 tab by mouth twice a day before meal. So what are the information? What are the information missing on this last prescription? I say a pharmacy technician dispense a medication, but forgot to include these 2 critical details on the label. 1, the expiration date. 2, the pharmacist's initials. So what is wrong? The expired date needs to be there because that will show the validity. That will show that the drug is safe for the patient. Yes, that will show that the drug is safe for the patient. When the date of birth, the expiring date is there, that will show that the medication is safe for the patient. When there is no initial for the patient, for the pharmacy technician, this prescription is not authentic. They were not able to trace. They were not able to know who writes this prescription because there is no information about the prescriber. So they will not know. They will not able to trace who prescribed the information. They prescribe this prescription. The one that prescribed it, they will not know because there is no details there. And 2, it's not safe. It not show the safety of the drug. And let's see, the expiration date ensure the medication is safe and effective. 2, the pharmacy initials are needed for accountability and tracking who dispensed the medication. Thank you.